As a woman, you must have ignored this condition and there is a high chance that you may suffer from inguinal hernia. Most of you believe this is something that only happens to men. This is because men are about 8 times more likely to develop inguinal hernia. But this does not ensure that a woman will not develop this condition. In case of women, mostly the diagnosis is delayed because it is simply not on your checklist. So to make sure that you do not miss it, today I am going to answer the questions I have received from women across the country and tell you what exactly inguinal hernia is and what to watch out for. So Priya from Pune asks, Doctor, I keep getting a dull aching pain near my groin, especially after standing, walking, coughing or lifting. My pelvic ultrasound was normal and there is no big swelling that I can see. Can women still have a hernia without a visible lump? Priya, that is exactly the kind of question I wanted to start with. Because most women do not present with a dramatic lump. Let me explain what is happening inside your body. In your lower abdomen, near the groin, there is a natural passage called the inguinal canal. And in women, this canal carries something called as the round ligament, a fibrous band of tissue that runs from the uterus towards the groin area and helps hold the uterus in position. This passage is normally narrow and well supported. But if the surrounding abdominal wall becomes weak and tissue from inside the abdomen pushes through it, that is an inguinal hernia, and just below it sits another passage called as the femoral canal, through which blood vessels travel from abdomen into your leg. That femoral canal is even narrower, and that narrowness matters because if an intestinal loop enters it, the intestine has very little space to move and can get stuck more easily. So in women, the hernia may not always show up as a visible lump, and sometimes the only sign is exactly what you have described: persistent groin pain or a dragging discomfort. So Sunita from Indore says, I've had 3 children and after my last delivery, I went straight back to housework, cooking, lifting buckets and picking up my baby. Lately, there has been a dull aching pain in my groin. Could the pregnancy be the reason or should I be worried? So this is not the only case I have heard. Pregnancy is the single most significant reason for a woman's abdominal wall weakness. And each pregnancy raises the pressure inside the abdomen consistently for 9 months and places sustained stress on the abdominal wall. Multiple pregnancies compound this, and the postpartum, that is post-delivery period, is a particularly vulnerable period where the wall has been stretched and weakened, yet most women in India return to full household activity within days of delivery, lifting buckets, carrying the baby, climbing stairs. Beyond that, chronic constipation is something which is more common in women than in men, especially with irritable bowel syndrome, which means daily straining on the toilet over years, which applies the same pressure. Heavy domestic and agricultural lifting in the rural and semi-urban area adds occupational load, and in some women, the canal is just naturally wider, and that is structural, nothing to do with your lifestyle. So your suspicion is reasonable and it deserves a proper examination from a surgeon. So Meera from Jaipur says, my friend has referred me to a general surgeon. I am also more comfortable with a female doctor for this kind of an examination. What will the surgeon actually do and how do I find the best one? Now that is a completely reasonable preference, and you should not delay the appointment because of a female surgeon preference. A general surgeon will examine the exact area where hernias occur: the groin crease, the inguinal region, and the femoral area near the upper thigh. You may be asked to stand, cough, or gently strain because a small hernia may appear only when pressure increases in the abdomen. If the examination is not clear, the surgeon may prescribe a targeted ultrasound of the groin or the femoral region. That is very different from a routine pelvic ultrasound, which mainly looks at the uterus and the ovaries. So the key is not that you explain it to the radiologist yourself. The key is that the surgeon writes the correct scan to request. And if you prefer a female general surgeon, that is absolutely valid. On Practo, you can search for an experienced general surgeon and use the female doctor filter in your city. Please do that rather than postponing care because the symptom feels awkward to explain. So Kavita from Nagpur says, the surgeon has confirmed that it is a hernia. He has given me 3 options. One is about an open surgery, second is laparoscopic, and third is a robotic surgery. And I am confused which one is best for me and how do I decide? So this is a very important decision, and let me walk you through all the three first. And please understand that medicines, exercise belts or waiting will not close the defect of hernia in your abdominal wall, and surgery is the only treatment. So the first option is called as the open mesh repair. This is a small incision that is made in the groin. The hernia is pushed back into the abdomen and a mesh is placed to strengthen the weakened area of the abdominal wall. It is a well-established operation and is suitable in selected cases depending upon the size of the hernia, your fitness, pregnancy status and the surgeon's assessment. The second is a laparoscopic hernia repair, where 3 small keyhole cuts are made and a camera is placed inside along with some instruments. The surgeon repairs the weak area from behind the abdominal wall. In women, this approach has a special advantage that I want you to understand very clearly, as it allows the surgeon to inspect both the inguinal as well as the femoral spaces from the inside. That matters because femoral hernias are easier to miss from the outside and are more likely to get stuck. So when a femoral hernia is suspected, which is more common in women, then laparoscopic repair is often preferred where the expertise is available. The last one is robotic assisted repair surgery, which follows the same principle as that of a laparoscopy but uses robotic instruments for better precision and 3D vision. It is usually reserved for complex, recurrent and bilateral, which is both side hernias, and is available only in larger metropolitan cities. The recovery is generally quick and walking starts early. Light activity in 1 to 2 weeks and heavier lifting only after surgical clearance, usually around 6 weeks. So Neha from Bhopal says, after the operation, when can I go back to cooking, lifting my child and being intimate with my husband? Will there be much pain and what should I be watching out for? This is a very practical question, so let me give you practical answers only. In the first week, expect some bruising in the groin area and a painless fluid collection at the site of incision, and that usually resolves on its own within 4 to 6 weeks. Return to light household activity in 1 to 2 weeks, but heavy lifting, including picking up your child if she is more than 10 to 12 kilos, is restricted for at least 6 weeks. Full physical clearance comes at the 6-week mark. Also, sexual activity can resume at 2 to 3 weeks once there is no significant discomfort present. As for the warning signs, you should contact your surgeon immediately if you develop fever above 100 degrees, increasing redness or pus at the site of incision, or pain that is worsening rather than improving from day 3 onwards. Remember, improving pain is normal, but worsening pain is not. So, if you've had groin pain or pelvic pain for more than 3 months with investigations that have not found a clear cause, then the next step is a clinical examination by an experienced surgeon, looking specifically for both inguinal and femoral hernia and not another pelvic ultrasound. Find a general surgeon on Practo and use female specialist filter if that is your preference. If this video helps you, please hit the subscribe button on the Practo for Her channel. Thank you.